our community transmission levels continue to remain low, as you see here. On a daily basis, we have seen anywhere from 2 cases. I believe there was one day over the weekend to, I think, 12 cases was the most. This morning we had 9. Our test positivity rate remains in the 0.3 to 0.4 area, and our case rate, again, bounces due to the slight variation within those numbers is anywhere between 0.45 to 0.8 on a daily basis. And this is important because obviously you've heard everyone's talking about different variant strains that are out there. 97% of new cases in the state of Maryland are in individuals who've not been vaccinated. And so let me just emphasize that point. New cases are coming in those who are not vaccinated. Hospitalizations, I believe 89% of hospitalizations and 89% of COVID-related fatalities in the state in the last month have been for individuals who have not received at least 1 dose of the vaccine. So when we're talking about the influence of variants, when we're talking about the risk of variants hitting our community, it is hitting individuals who've not been vaccinated. So there's just yet another reason to ensure and emphasize to folks who've not been vaccinated and encourage them to get vaccinated, because that will help drive our numbers down even further. Now, when we look at the vaccine numbers, if you look to the right, again, the numbers dependent upon your denominator. We have now, for the population who've received at least 1 dose in Montgomery County, we're just shy of 75%. 67.3% of the entire population, that includes individuals under the age of 12 who are not yet eligible for the vaccine. We're at 67%. And when you just look at individuals who are over the age of 12, including everybody who's eligible, we're actually right at 80% of our population being vaccinated. And so we celebrate this, we're encouraged by this, and when you look at the age breakdown, the numbers are even more staggering. When looking at our over 65 population, we are now at 98% of that population receiving at least 1 dose, and over 18, just shy of 90% of that population receiving at least 1 dose as well. Now, that means we still have over 200,000 folks within our county, including those under 12, who have yet to be vaccinated, and it's important to drive that number up as high as we can, again, to minimize the potential impact of any of the variant strains. As it currently stands, based upon the data that's been provided to us, the predominant strain in the state of Maryland continues to be the Alpha variant, or the UK variant. We have seen a small handful of cases of the Delta variant, or the Indian variant, reported in the county, but it has not been to the level, at least of those that are sequenced, that we are seeing in other countries overseas. And just you can take a look to see the volume, the weekly volume. It has continued to decrease overall as the percentage has increased, and we still see a percentage of children coming in getting vaccinated as well, because it's important to make sure that our children are covered, particularly as summer activities open up and children return to school settings, both in summer school setting as well as in the fall. This just shows you again where the primary providers and sources of vaccines, where folks are getting. It's important to note the county apparatus has consolidated, as we've talked about before, into 3 central sites. We're working on Up County Regional Service Center and the Germantown Mass Vac site will, its last operating day will be on this Friday, and those efforts will be consolidated into the Up County Regional Center. We also are doing vaccines and testing at that site, as well as Dennis Avenue, and we're working on potentially utilizing the 401 Hungerford building in Rockville as a central site within the county. And when we look at the increase in percentage of our populations covered, we are, as we've talked about in the previous session, the gaps have shrunk. In fact, Hispanic residents, the gap in relation to white residents in the county actually is higher. It's 5% higher in terms of getting vaccinated. The numbers aren't quite as positive for Black residents. However, it's important to note that that gap has shrunk from 17% in early April to 9%. And it's important to highlight that in consolidating our efforts, we're also making sure that we continue to use the geography that shows us where Uptake is lowest in different communities to target and focus outreach, as well as set up vaccine opportunities, working with our community partners, continuing to work with our community partners, as well as our federal and state partners to increase opportunities for folks to get vaccinated in those areas where we're seeing lowest uptake. This just again shows you running total of vaccines over time. And I will stop there, but I would also like to just highlight a couple of other demographic factors, particularly related to community transmission. We haven't, even though the number of cases is small, again, we're talking about in the last month, we've seen, in the last month, are you ready for this? In the last 30 days, we've seen 225 cases. If you recall, we had days where we had more than 225 cases, and we certainly had weeks where we had more than 225 cases. And so the N is small. However, when we break that down, some of the things that we were keen to look at were, are there any huge differences by race as well as age and geography? And when we break it down by race, looking at those 225 cases, and this was up to yesterday, the percentage of those cases break down this way. 17.8% for non-Hispanic white, 29% for non-Hispanic black, 1.8% for non-Hispanic Asian, 25.3% for Hispanic, 7.1% for other, and then 18% unknown from a racial and ethnic perspective. And when we break that down by age, the percentage of new cases in the last month, 9.8% ages 0 to 9, 11% 10 to 19, 18% 20 to 29, 19% 30 to 39, 13% 40 to 49, 12% 50 to 59, 9% 60 to 69, and for those over the age of 70, 6.7%. So just to give some perspective in terms of where we're continuing to see cases, I do also have, and we'll share this information with you all and send it to you all, we do have a breakdown by zip code as well, again, to help continue to drive our targeted outreach efforts to those different communities, again, working as a county, working with our community partners, and increasing opportunities. I will stop there as it relates to COVID, but also just want to give another reminder to, as Councilmember Jawanda says, the millions of folks watching at home. This is summertime also. It's hot outside. So because it's hot outside, I need our residents to do a couple of things. Wear your sunscreen and protect your skin when you are in the sun. I need you to make sure that you stay hydrated and stay as cool as possible, taking advantage of cooling opportunities if you don't have those resources available, of taking advantage of different cooling opportunities that the county and others provide. We also want to make sure that when folks are taking or participating in different activities, whether it's barbecuing or particularly swimming and those types of things, make sure that you adhere to the guidance, the safety guidance that is in place to keep yourself and to keep your family safe. We recognize that as the weather has improved and restrictions have been relaxed, that people are coming out in droves. We want you to celebrate safely and be able to enjoy being around others, but again, we want to make sure that you're safe in that process. We also recognize that, again, as people start to mix more and the calendar moves forward, that we're going to see other things pop up. We're going to see allergy-related illnesses. We're going to see colds and things like that spread from person to person as interactions increase. For kids, we're going to see things like adenovirus and enterovirus and diarrheal type things, again, as they get exposed to other kids and back into society. So we want to make sure that you are cautious, you do seek the necessary medical attention as needed, and don't be afraid to access your primary care physician for any of those types of services to get them addressed. I will stop there and turn the floor over to Dr. Stoddard. Don't know if Dr. Bridgers had anything to add, but as always, happy to answer any questions you all may have. Thank you.
Thank you, Dr. Gale. One quick point just to add to all those great data points that you indicated based on our surveillance and syndromic data. 4 out of the 6 hospitals in the county reported no COVID-like ICU patients over the past 5 days. And the other piece that you illustrated in the graphic as our targeting strategies to decrease vaccine hesitancy and apathy is that we continue to look at those best practices and models based on relevant CDC peer review or other peer review articles for models that will increase our community engagement and participation and identify those trusted sites. Just wanted to add those pieces subject to any additional questions. Thank you.
Good morning. I have just a few additional comments. I actually did a little bit of research over the last couple of days to try and address some of the things that we've talked about in the past. Right now, the Pfizer trial for ages 5 through 11 is proceeding. They've got a number of sites across the country. They're recruiting and doing the trial on 46 young people between ages 5 and 11. What they're actually doing is actually reducing the dosage for the younger individuals by about 2/3 to test whether that's safe and efficacious and produces the necessary immunity. They anticipate that trial will proceed and the results will be available in September. So that gives you a time frame sense of when we're talking about the ages 5 to 11 vaccinated. So given where this trial actually is and it's proceeding, the phase 2, phase 3 trial, I can't imagine we're going to see results or an approval before at least mid-September from FDA, if not later. The other thing I wanted to comment on is you may have seen yesterday there was a study that was done of the Pfizer and Moderna mRNA vaccines that suggests that the immunity provided by those vaccines actually is much more long lasting than we had anticipated. And it's another boon, which means that we may not need the boosters in order to boost the immune response. The only way we would likely need the boosters is if the virus mutates to a strain that is not protected currently by those vaccines. Now, the study did not include the Johnson & Johnson vaccine, so obviously that's sort of a addendum to that. They need to take a look at that still, but it does give some credence to the possibility that we may not be doing as many boosters, or at least along the time frame that we thought we were going to need to do boosters, or we suspected we might need to do boosters based on earlier comments. And so that was good news overall. The final thing I want to say is, this is a note that came out of Secretary Schrader at the state. Right now, 97% of new cases are amongst the unvaccinated. 89% of the hospitalizations are among the unvaccinated, and 89% of the deaths are amongst the unvaccinated. And so if you needed a greater rationale for getting vaccinated, that should be the compelling thing. Vaccines are safe and effective, and they are preventing people from dying from COVID-19. And the data is staring us in the face. So I'd certainly echo what Dr. Gales and Dr. Bridgers have said. Please do get vaccinated. I'll stop there.
Terrific. Okay. If that's it, thank you so much. Let me call on Councilmember Rice.
Well, thank you very much for this great update and great news. Dr. Gales, I'll start with you. The percentages are absolutely amazing, that 97% of new cases come from folks that are not vaccinated, but also concerning because those that are not vaccinated continue to be our people of color in our community. And although we're making great progress, it is still something in which we need to continue that outreach. And so I just encourage us to continue working with, obviously, our BIPOC health communities that are out there, including our doctors. I know that you're all doing all of that. So just again, lifting up the importance of that, because we see how effective the vaccines have been at not only minimizing the contraction, but even then, if you did contract, the hospitalization numbers at 89% are just simply amazing. And so, I'm not sure what other vaccines are out there that have those same kind of rates, but I mean, that's pretty impressive. I would like to ask about, because we still continue as a part of the hesitancy, and so I'd like you to talk to those folks who have still chosen not to get vaccinated. We have more data now and more time that folks have been vaccinated who are concerned about complications. Please talk about the lack of complications that have come about as folks have been vaccinated and now have been vaccinated for some folks almost 5 months now at this point, I would think, right? So very, very significant information as far as the lack of complications from vaccinations?
Sure. Thank you, Councilmember Rice, for your question. You are correct. So the complications have been minimal for those who vaccinated. We certainly are aware of the period of time where there was a review of the Johnson & Johnson vaccine due to concerns about clotting issues. But that was reviewed, it was investigated, and has ultimately, for the most part, been resolved. We've not received or heard a lot of information about that. There have been a couple of reviews of the vaccine for younger people in terms of potential increased risk of cardiac inflammation. Again, that was reviewed and very minimal and not dismissed, but documented, but not a red flag to stop using it. And so with the exception of those two instances, really the extent of side effects have been what some folks have described as, at most a 24-hour period after receiving the doses of having some fevers and chills and some sense of fatigue, but they have responded and resolved quickly. I can personally attest to I received my first dose in December and second dose in mid-January. And I feel like I'm doing okay. I mean, I feel like I look okay. I'm responding okay and haven't had any adverse responses, as well as the hundreds of millions of folks who've been vaccinated in the country so far. Now, conversely, we still see, as we pointed out, the information that the state released today, that those who aren't vaccinated continue to have complications if they get the illness. A significant portion of folks, particularly with the new variants out that are more aggressive and more contagious, aren't landing in the hospital, and they're continuing to have complicated courses, and they're unfortunately also we're continuing to see COVID-related deaths. And so when you stack those two against one another, if you are a numbers person from a cost benefit perspective, the benefit from getting the vaccine in terms of the side effects is quite minimal, again, compared to the side effects experienced by actually getting COVID-19 and potentially having the complications. And then strictly from looking at the notion of some kind of the historical perspectives and hesitance around, what the vaccine does. Let me be very clear. Vaccines don't have chips in them. Vaccines are not going to track. Vaccines have proven to be safe and efficacious as we laid out in terms of the minimal side effects and certainly the lack of presence of any long-term effects associated with it. So in my mind, I think the evidence is clear that they are safe, they are efficacious, and they are an extremely beneficial tool to keep you safe as well as your family safe. And honestly, I'll borrow the theme from our ending the HIV epidemic and put it in terms of getting COVID vaccination. Do it for you. Do it for you to keep yourself safe out of the hospital and alive, and do it for your family to make sure that you don't potentially transmit it to them to keep them safe as well.
Well, here to that. Let me ask you about, and Dr. Stoddard mentioned this, so I think maybe he anticipated my question about boosters that I've continued to ask a number of times, especially when it comes to the COVID variant. Folks are to the Delta COVID variant, that folks are concerned about Johnson & Johnson. And so for those who have gotten the Johnson & Johnson vaccination, what do you tell them in terms of information about potential boosters?
So I was actually trying to look simultaneously at, I saw some articles trying to look at Johnson & Johnson, but and I do think that I think that's the one, I think one of the areas where I think we may need a booster based on the early data with Johnson & Johnson. They're doing a more concrete study right now to analyze exactly what the differential of immunity might be. As we've talked about previously, the Johnson & Johnson is made by a slightly different process, and that may not produce the same type of immune response against the same targets on the virus, and so there will just be natural variations between the models. And so there's a discussion certainly now. Certainly I've seen articles over the last 72 hours suggesting that that may be where we need boosters. But I think the reason at the end of the day, if the Pfizer Moderna vaccine are effective against Delta, that helps us because that's number one, we've done a lot of those, but also it allows us to focus on on the much smaller number of Johnson & Johnson recipients and get them boosted faster and more effectively, I think, than if we had to do the whole population over again. So I think more to come on that. There is no definitive announcement from Johnson & Johnson at this point about the vaccine, but I suspect based on the early data, that may be the one place where we're talking about boosters is the Johnson & Johnson recipients over the next 4, 5, 6, 7, 8 months. So
to that end, there have actually been some concerns about folks who have gotten the Johnson & Johnson vaccine who then just go and get Moderna or Pfizer just because they want to make sure that they feel that they would be protected against the Delta variant. I know there have been concerns that have been raised about potential of mixing of the two vaccines. Can you talk a little bit about that? Just give some advice to folks who, read these articles, may be concerned about, their susceptibility to the new Delta variant. So therefore want to make sure that they're ramping up as much protection as possible. What advice do you tell people out there in the community who've gotten Johnson & Johnson and who are concerned about Delta and think, well, maybe I should just go and get Moderna or Pfizer on top of the Johnson & Johnson vaccine?
Well, what I would say is this, is the Johnson & Johnson vaccine has provided great coverage and great protection so far throughout the pandemic. And again, to emphasize the notes from earlier, 97% of new cases are coming in people who have not received a single dose of a vaccine, whether it's Moderna, Pfizer, or Johnson & Johnson. And so based upon the limited information or the information we have so far, there isn't any suggestion at this time or recommendation that individuals take those actions. We have not seen, I know that, there's still a lot to be discovered. And I believe I read this morning, there's a couple stories of people in other countries who have been doing that, to get a top off, if you will, of the other doses. The information right now suggests that individuals who've been vaccinated across the spectrum are protected and aren't showing up in the emergency rooms and hospitals and aren't showing up as the new cases overall. Now, we may find out that, again, there may be a need for a booster in the future, but as it currently stands, there's no definitive information to suggest that that is an action that individuals who receive the Johnson & Johnson dose should take at this time.
Oh, go ahead, Dr. Snyder.
yeah, I was just going to say, I think they're actually in the process of doing some of these, crossover type studies. I would definitely not encourage people to do their own personal studies absent scientific data, and certainly I wouldn't. We don't want people experimenting with taking. Let's try and collect all the vaccines you possibly can, just because obviously that there are, that's not been fully studied, and so we don't know what the long-term or any of the implications of that may be. They're looking at that now because I think that, that may be a strategy that's utilized is to follow up the people who are currently received the Johnson & Johnson with the Pfizer and Moderna, but we would want to have the scientific evidence before that was recommended.
So thank you very much for you guys both saying that and advising the public to trust the vaccines, trust the data that we've seen at this point. Again, highlighting the fact that 97% of the new cases from folks that have not been vaccinated by either of the 3 vaccines. So the advice to the millions watching at home is to trust the vaccines that you've got. We've seen great numbers that have come out of it. And for those who have not been vaccinated, please get vaccinated, because look at the efficacy rates that we've seen right here in this county that show that you are protected. So that's what I'm reading. That's what I'm hearing from you, and really think that it's promising for us as we continue to try and get even more of our residents vaccinated. Thank you so much to both of you. And thank you, Mr. President.
Thank you. Council Vice President Albornoz.
Well, thank you, Mr. President. I just continue to be amazed at the progress that we've made over the last year plus. But and again, credit to all of you guys for your hard work. I want to we acknowledged at the joint HHS and GEO committee session yesterday the great news that the Latino Health Initiative was recognized for their Abuelina campaign with a capital Emmy, which is truly remarkable. And I think that, along with the other very creative programming solutions and initiatives of our BIPOC health initiatives has been just really remarkable. And so much to build off of the Black Doctors Network and so much more that gives me a lot of faith that we're actually going to come out of this stronger and take some lessons learned from prior to the pandemic. I actually have a little bit of a left-hand turn question, Dr. Gales, and I'm going to catch you a little flat-footed here, and you as well, Dr. Stoddard, so I apologize. But this is sort of hot off the presses. So last night I participated in a fire and rescue ride-along for a better part of the evening. I was working out of the Wheaton station and had the opportunity to both visit the Wheaton Volunteer Fire Department as well as the other fire department on the corner of Georgia and Randolph. And one of the things that I found alarming was that over the course of the 4 or 5 hours, a code yellow was issued at all 6 of our hospitals, which meant that there wasn't an emergency bed available. Now, it's important to note that should there have been an accident, the fire and rescue squad still would have taken and the patients would have been prioritized had they had very serious issues. But what that meant was it created a code blue for fire and rescue. And so if it's a non-emergency case, they would literally have to wait in the parking lot until a bed was open with the patient inside the ambulance, which obviously takes the ambulance out of use for other issues. And this happens regularly. And so now it's a combination of a number of factors. I know too many people just go to the emergency room for non-emergency issues and issues that should be diverted to a different location. The other thing that fire and rescue reported, though, was the alarming number of mental health calls that they have been responding to, especially over the last 9 months. And, those folks, there aren't enough beds. And this obviously crosses over into the behavioral health space, but it has public health implications for obvious reasons if our emergency rooms are tapped. So just would love to get your reactions and thoughts. I think that we're going to have to expand on this. We know that hospitals during COVID, the ICU beds, the emergency room beds, period, there were several instances they reached alarming capacity issues, but it was sort of news to me and concerning that this is an ongoing issue, particularly in our emergency rooms. And I know I'm catching you flat-footed here, but wanted to just get your immediate thoughts and feedback to that.
Well, thank you, Councilmember Albornoz, for your question. And so slightly flat-footed, but not so much in another way. So the flat-footed part is certainly, without knowing the specific details of yesterday's numbers, surveillance numbers, I couldn't comment in terms of further causes about what may have led to the code yellow. What I can say is, looking at our surveillance data over the last several days, hospitals have not been overburdened with COVID-related illnesses and those types of things. And as Dr. Bridges mentioned, in fact, the census is extremely low as it relates to those issues. And it could be a combination of a couple of factors. As I mentioned, there's other things that are happening and people are getting out and, they're more active. There's broken bones, those kinds of things, and people are showing up in the emergency room. But I would be hesitant without being able to go through and look specifically at the data to be able to comment further. Now, on the other side, you mentioned something that was a reality before COVID and will become even more so a reality in the future, is that people frequently utilize the emergency room space for behavioral health care because there is such a shortage of care in other places, both from an outpatient and an inpatient reality. Now, as it relates to the inpatient side, unfortunately, many hospitals don't have beds available to provide inpatient psych or behavioral health services. We know that this is an extreme issue as it relates to pediatric behavioral health issues, as there's a huge shortage of pediatric-related behavioral health beds across the state. And so unfortunately, oftentimes, whether it's a child or an adult, is that hospitals have to keep or utilize emergency room space to house that patient until they're able to link them to some type of inpatient bed. Now, that type of stay and utilization of that emergency room bed can average from a few hours to multiple days. And so what you're mentioning speaks of a larger crisis that is in our behavioral health system, not just here locally, but also from a region and a state perspective, that is indicative of a lack of access to primary care behavioral health services, a lack of access to inpatient psych services, both in terms of beds available as well as providers to be able to staff them. And then the third component is lack of access to meaningful outpatient services. And so I think, I certainly look forward to a further conversation and being able to get our colleagues from behavioral health and crisis services engaged in that. But I do think it's going to take on added significance as I do think mental health will continue to be a significant post-COVID issue that's going to require some creativity to be able to address those gaps in services that I just mentioned.
I'd like to add a little bit too. So a couple things. And so Dr. Gales, remember this, during COVID, the state convened these sort of surge calls where they were looking at baseline bed capacity and the ability to surge beyond that. I think one of the big things, and they did them like jointly with several different regions. I think one of the big things that I took away from that meeting is our bed capacity in our region of the state is below really what it should be, and is really below the capacity, not in total capacity, but in terms of population compared capacity to several other regions around the state of Maryland. So and it's even worse, I think, in the case of mental health beds. And so I think what we're seeing is this is an underlying condition that in Montgomery County that is being exacerbated. And I'm actually looking at we get a syndromic surveillance report. It's Essence is the chief complaint system that we get where, chief complaints coming into the ED are reported up to the state, and they collate the rates of various things, and they show us the data across each region. We're in region 5 in the state of Maryland. And our rates are actually lower than most places across the state. But when you take a rate-based stat against a very high population, the numbers increase. And so I think, this is an issue that we need to have a lot more conversations about, as Dr. Gale said. I think there is a bed deficit, both in terms of acute care and other frontline beds in Montgomery County. I also think there's a even bigger deficit across the entire state of Maryland in mental health capacity. And this has been an area of much, I know the correctional facilities have dealt with this a lot, getting people are incarcerated rather than being put into treatment. There's a massive issue with all of those things in the state of Maryland that needs to be addressed more holistically. And I know there's been some efforts to address it, but not nearly enough. And so certainly I'm glad you raised this. We are seeing much more use of the blue alert than we have in recent years. I've watched this trend. I get notified every time we go on blue alert, and it's just been more frequently and longer duration over the last 4 or 5 years than it was during the first several years I was working in the county. And so it's definitely an issue. It's an issue that's getting worse. All the things that you raised with people using the hospital system as the first line healthcare, lack of mental health beds, they're all realities, and they're not going to get better. There's some things we can do to address the demand, but also we probably also need to address the supply at the same time.
Thank you both. I learned a lot just in both those comments. That was amazing and very helpful. So I definitely am going to follow up with you guys. I think, we've discussed the behavioral health issue extensively and the lack of bed issue. We need to continue that conversation, and I think expand it in light of what you all just said. Last comment, just quickly. So had the opportunity to visit my dentist yesterday, first time in over a year, full disclosure. Since the pandemic. I know a lot of people are starting to go back to the dentist, go back to their doctor's visits to get, back on a cycle, but there are a lot of people who are not getting back on that cycle. So Dr. Gales, if just some words of encouragement to our residents for preventative care purposes, the importance, if you will, of going back and getting those regular checkups, those regular cleanups that maybe people held off of during the pandemic, but now that we're in such a better place, encouraging people to do that again.
Oh, thank you, Councilmember Albanos, and thank you for sharing your story in terms of that. I myself am trying to do that right now and coordinate appointments to get everything taken care of and topped off and checked on. And so just again, to emphasize folks at home is I know that COVID has been dominating all of our minds and shaping and influencing all of our actions but there are a lot of other health related things going on as well, globally, as well as within your own body. And it's important to make sure that you do the due diligence, not only in terms of getting that checked on with your primary care provider, whether it's through your somatic health provider, your dentist, or others, but it's also important from a global perspective that we continue to, keep checking on those things, because hopefully COVID will be something of an afterthought in the near future, but we still have to live and move on, and we want to make sure that everyone continues to be as healthy as possible in terms of doing that. And I actually would tie this back into your previous question and comment related to hospitals. It's important to do preventative health in general, because preventative health is what keeps us out of the hospital. It keeps us out of the emergency rooms, and it frees up those resources for individuals who have acute crises who need those the most. So please take a stock of where you stand in terms of your health. And even if you're feeling good and feeling fine, it's important to make sure you go get that checkup and get the preventative services that you need.
Perfect. Thank you so much. You said it beautifully. I yield back to you, Mr. President.
Thank you so much. Councilmember Novato.
Thank you so much. I appreciate the opportunity to first say thank you to the team for getting us to this point. It seems very kind of unreal and surreal to have these types of conversations be so different. Well, many of the questions I had have been answered thus far. I was curious about the booster issue, and also a little bit regarding the variants, and really enjoyed seeing the presentation and all the accomplishments. We do have more work to do, but it seems like we're on the right track. Excited about some of these awards that are recognizing the shared work here. But just in general, I think that there's, I'm still picking up a bit of just confusion, a little bit, I guess is the word, as people begin to go out, as people begin to, go to restaurants or go to retail, etc. The whole issue of wearing the mask, not wearing the mask. What should we be doing? We're, tracking the Delta variant, et cetera. So if you had to just give a general sort of, directive or just message to the community, what would you say overall in terms of how are we navigating this space where we feel pretty confident, but obviously we hear the news, we read the articles, we look at the data, and we realize that we're not totally there yet. What would be your general message?
Thank you, Councilmember Navarro, for your question. I think there are a couple of tenets to that. The first one, if you're not vaccinated, get vaccinated. I think that's the most important thing out there. Second, if you are fully vaccinated, again, the studies show that you are protected against the variants and that you have a very good chance of not getting COVID, and certainly in the very extremely small chance that you won't have any type of significant illness related to it. And I know that this is a big issue as we continue to move forward in terms of people still, there are different comfort levels in terms of wearing face coverings in different settings. And what I would encourage folks to do is even though, the numbers say that you're there, we recognize that people have different levels of comfort, and would encourage you to continue to do what you feel comfortable doing to keep yourself safe. Understanding that the data back there does support you in terms of giving you some added sense of comfort and confidence that you are protected from COVID. We also, I think the third thing would say is that particularly as it relates to unvaccinated populations, well, the second piece of the second thing is, before I get to that is, and certainly if businesses still would like to require or have certain parameters in place, such as face coverings and distancing, they have the right to do so, and we would support them in doing that. And so that can be their own prerogative, and their ability to enforce that is within their rights to do so. The third thing I would say is, and this relates to those who are unvaccinated, particularly children who aren't eligible, because we've seen a fair amount of questions pop in related to that. And the advice and guidelines that we have put forward and shared with you all and are recommending to folks is consistent with American Academy of Pediatrics, that still says it's a really good idea and strongly recommend for children who are under the age of 12 to wear face coverings because they're not vaccinated in settings where it's difficult to maintain any type of physical distancing because they are still susceptible because they've not been eligible to receive the vaccine. So those are three key messages that I would say in terms of hopefully alleviating some of the confusion out in the community.
Thank you.
Thank you. Councilmember Reamer.
Thanks so much. Just a brief observation on the news about that we may not need to have booster shots. That is incredibly good news for global distribution of vaccinations. I am sure there's probably hundreds of millions of doses that will be available sooner than would otherwise be available if, not only US, but other countries aren't reserving them for a booster shot. So I hope that can bring several months, if not, even more of an acceleration to our global rollout. And it's wonderful news. Once again, the vaccinations are a marvelous scientific achievement. Wanted to ask Dr. Gales, I couldn't write fast enough when you were reciting some of the statistics you provided us. Thank you for the last 200 plus cases you had compiled. If you could share the demographic breakdown again, please, I would appreciate that.
Sure. I'd be happy to just email you all the folder with all the information, and then you can take a look at it and how it breaks down by rate. We've got it by race and ethnicity, by age, and then also by zip code. Sure.
That'd be great. If you don't mind repeating it now, I just wanted to tweet it out, to be honest. And if you don't mind saying it, I'll be able to get it down. But generally speaking, we're still seeing, of course, I'm not surprised the numbers haven't changed dramatically, but the chart doesn't look particularly different in the last 2 weeks or so in terms of vaccination rates along the border of the county, the eastern border of the county. And, it looks to me as though there are census blocks where we have rates as low as 30%, kind of all along the county border. And we talked a bit about that last time. Just wanted to ask, have there been any enhanced programs put into place? What can you talk to us about what additional efforts we're going to undertake there to try to really focus in that particularly important in those important communities?
Sure. Well, just as a note, I'm literally going to send you the file right now so you can take a look at it and then tweet out how you can actually copy it and paste it. That'll be easier than reading through. But in terms of, and then again, others may be able to contribute to this piece. In terms of, as you mentioned, particularly locations along the border that we share with Prince George's County that you referenced, there have been a couple of efforts. I know the state has been doing a couple of clinics targeted in that, focused within that area, the Langley Park area and Tacoma Park area. And we are looking to try to partner with our colleagues in Prince George's County to also increase the number of opportunities within that space. And additionally, I know that at least I believe CASA was also doing some additional clinics within that area as well last week. And so that, again, highlights multiple areas where we're hitting it from the state and federal level in terms of positioning those FEMA type opportunities and mobile units within that area, as well as some of the other spaces where we see lower levels of uptake. We also are continuing to utilize and leverage our community partners and our MHIPs within the county to do outreach, encourage folks to get there, as well as help facilitate getting there and having opportunities. And then the third level is, again, looking at some other potential partnerships across counties actually and across the region to be able to stand up some opportunities.
Okay, great. Thank you.
The only other piece I'd like to add to that is Dr. Gales has been working with the Medical Society of Montgomery County, as well as requesting a list of all those providers in that area. We know that the providers are trusted entities, so we're following up with those providers in those areas to increase the vaccination rate. So we're working with the providers along those lines and reaching out to them more just to see if they're seeing any hesitancy or any apathy or any suggestive strategies to increase the vaccine, getting more shots in those areas as well. So he's particularly targeting the providers as well.
Okay, thank you. I want to encourage again a enhanced strategy for our, for that concentrated part where we have lower. It's not the only place in the county where we have a lower rate of vaccination, but there's a fair number of contiguous communities. I had earlier said I wanted to introduce an appropriation to support incentives for vaccination campaigns. Unfortunately, that has gotten tied up in I think really the bureaucracy of appropriations from the federal relief funding and the process that we're going to go through, which to me is a little disappointing because it's so urgent. But I really want to just continue to say, I think we've got to have that tool in our tool shed, our toolbox, and it could help. We might be able to get thousands more people vaccinated with some really smart, effective marketing strategies relying upon incentives. So I know it'll be in our upcoming round of talks about how to allocate ARPA funds. And I think we've got to have that available to our community partners to use, or the county government, however it's best. But it is proven to be effective. It is proven to help break down hesitancy. And, I think we ought to do it. I think the executive branch could certainly do it on its own. I don't know whether you need anything from the council in order to just do it, but we can certainly, I hope, include it in the ARPA funding, strategy as well. Okay. Thank you.
Thank you. Thank you, Councilmember Katz.
Thank you very much, Mr. President. And once again, thank you, Doctors Gale, Stoddard, and Bridgers for everything that you're doing and your entire team. You truly have taken us from a place that we did not want to be at all to a place where we're seeing that we truly can get to that goal line. I did want to go back to what Vice President Albornoz was discussing about the shortages of beds for their hospitals. And Mr. Vice President, if it meets with your approval, I'm going to suggest that HHS committee and Public Safety Committee have a joint session on that very, very topic. And I think, and we're going to need some guidance from our medical experts here, but I would assume that in order to get more beds, that someone has to request it, that it's not just something that the state comes in and says, oh, by the way, this is what you have and this is what you need, and we're going to help you get to the better place. Does a hospital have to request it? How does that process work?
Well, thank you, Councilmember Katz, for your question, and we're happy to provide any insights that we can and any of the further future conversations. And so just to clarify a little bit, bed availability is actually a little complicated. It's more complicated than just, we're requesting, could we get 15 more beds in the hospital? It's tied into a lot of different things. In particular, it's tied to workforce and the level of specialty staff that are available to be able to provide those services. As you may well know, that there is a shortage of behavioral health specialists across the board, both psychologists as well as psychiatrists, to be able to administer that care. So that also is a rate limiting step, if you will, in terms of the bed availability. So the state actually does, and the state does provide the insights in terms of licensing and certification of all of the staff and of the resources that would be needed in terms of being able to staff and increase those beds within the respective spaces. And also in terms of specialty care, for example, a lot of hospitals may actually have the physical beds there, but again, not the certified licensed staff to be able to provide that level of services and kind of the complicated nature of those services that are required.
So are you, if I could understand what you were just saying, are you saying that it could be a possibility, not that it was, but that it could be a possibility that there was an actual bed, a physical bed available, but no one to have the personnel to help the person in that bed, and therefore that's one of the reasons it went to code yellow?
Well, again, I'm not, I would
I
be
know you don't
hesitant
know
to,
for
yeah,
sure. Yeah,
that's
yeah.
right. But in general, the lack of, even if there's a physical bed available, as we learned through COVID, if the staff is not available, the specific staff that's, trained and certified to provide that care, then that bed is not able to be used for that particular purpose.
I got you. I think
this is incredibly. I think a joint session would be very helpful. This is like it may have been that they didn't have enough staff scheduled as well. Like there's a whole range of possibilities here, probably 10 to 15 variables that you'd have to think about in assessing what the actual deficit is. I just know that from what we've talked about, when you talk, each hospital is licensed for a certain number of beds for sure. There is a number that they're approved to have. Not all hospitals, in fact, most hospitals do not operate at that maximal number with great regularity because of things that Dr. Gales has alluded to and others. But even if you look at that maximal number, the ratio of that maximal number to our resident population is smaller than it is in other parts of the state. And so while our total number may be comparable, we've got much more population. And so this is a very complicated issue and one that we probably should take I certainly encourage you all to take a fair bit of time looking at, because I do think there are some gaps here that we can help address at the county level. But I would not want to besmirch the hospitals for saying that they're intentionally understaffing or besmirch. It's a complicated system, and as Dr. Gale said, in this specific instance, it may be different than some other specific instance. You'd have to just understand what all of the variables are at any given time to understand exactly what the situation is.
Thank you. And I know that Dr. Crowell has talked about this as well. This is not a new topic, but if you could help us for that joint committee meeting, and we'll certainly meet with Dr. Crowell as well, that if you could help us tell us who should be at the meeting so that we can have a fruitful discussion to get ourselves to a better place. And from the sound of what Dr. Stoddard just had to say, we might need more than one meeting to get us to that place. But I do believe if we don't start the dialogue, then we're not doing the right thing. So thank you, Vice President, for bringing it up. And thank you all, because we will need that meeting. Thank you, Mr. President. I yield back to you.
Thank you, sir. Councilmember Jawanda.
Thank you, Mr. President. Good to see you all again. Dr. Gales, good to see you this weekend. Thank you for the work of your great staff at the Pride in the Plaza. It was a great event, and your whole team did a great job. I got my HIV test and did that, and thank you for providing that. Wanted to ask about the Delta variant. You might have said this at the beginning, but I might have not heard it correctly. Do we know the percentage of our positivity in relation to the Delta variant? I know they track that in some places. Do we have any sense of how much of the people who are contracting it, even though the numbers are much lower and we're happy about that, are the Delta variant?
Thank you, Councilmember Jawando, for your question, and thank you for participating on Sunday and coming out to the event. So the short answer is we don't have a definitive answer about the percentages because, again, not every sample is getting sequenced, and so everything's an approximation. What I can say is it still remains a small number of cases being reported as the Delta variant, as the state will send the local jurisdiction whenever a case is sequenced by the state and it's found to be a variant, they will send a note to say, hey, we sequenced this in the last week and 4 cases came back and they're A, B, and C variants. And just anecdotally, from a qualitative standpoint and reviewing those emails that I can think of in the last week that I've received, it's an extremely small number of Delta variants that are coming. The majority continue to be the UK variant. In fact, I received an email this morning that in the last week, the state sequenced 4 samples from the county that came back all UK variant. But I would say it's been a while since I've received one to say that, these reported as the Delta variant that's there. And the state right now, again, continues to be, at least in Maryland that I'm aware of, the primary and only site that is doing the sequencing for that, and would have the more exhaustive list about how the Delta variant shakes out across the state. But as it relates to Montgomery County, of those that have been sampled, again, the overwhelming majority continue to be the UK variant.
Got it. I was reading, I think yesterday or so that the 1 in 5 of the cases in the U.S. is now the Delta variant, right? And so, we know that people are traveling. At the same time, you have 2/3 or more of people saying, I'm open to traveling and going out for the summer and doing things. So we know that's happening. People are intermixing. And we see what's happening in the UK, where we have traditionally kind of lagged behind them in what they're seeing. And they've seen a resurgence in cases and have implemented some protocols. And I think I even saw that in LA County, they reinstated the mask mandate for vaccinated and unvaccinated people because of a rise in cases there. So I say all that to say, not to sound ominous, but just to say that and get your reaction to it is, Councilmember Navarro brought this up, like this kind of, and I've dealt with it. Like, I'm vaccinated. Do I put the mask on when I go inside? I still am doing it when I go in places where I don't know who's going to be there and I don't know people's status. I think that's, for me, that feels right. But from a medical perspective, with all that happening, are we concerned that what's the guidance to residents, with understanding that we don't know the status of everybody, and what would be your best guidance to residents, understanding that kind of backdrop?
Well, I don't think it is alarmist. I think it's just reality, and hopefully we've been very, clear and transparent about, the status of the variants. It's like we continue to monitor and look at the number of cases that are happening, the presence of the variants. We continue to look at those other community transmission metrics that we've looked at throughout the pandemic in terms of our hospitalization numbers and, our test positivity to get a sense of where we stand. So we're not spiking the football and not out of the woods because we continue to watch. Now, the thing that is a little bit different this time compared to, as you referenced, we've kind of lagged behind Europe and some other instances in the past, is that fortunately, this time we've got a larger percentage of our folks vaccinated to have some extra protection. And again, to emphasize, the data so far suggests that, particularly it's been out for the mRNA vaccines, Moderna and Pfizer, to be effective against the Delta variant. Now, obviously, we're going to continue to monitor to see if any other types of variants pop up and give, cause for additional concern. But what I would say is this is continue to we strongly encourage folks who are not vaccinated to get vaccinated. Quite frankly, those who are not vaccinated should be wearing face coverings to potentially, mitigate transmission from person to person. And if you are a fully vaccinated person, again, it's within your right to be able to think through, when you wear that face covering. Again, in your situation, your comfort level is when you don't know people, know their status, or you're in a mixed space, you're continuing to wear that face covering. I'm continuing to try to feel that out for me personally as well, in terms of the spaces I go and the types of activities that are included in it. And you did also introduce another interesting thing. Two interesting things. One, not to say that everything you say isn't interesting, but two interesting things. The first one is there are other jurisdictions like LA, Los Angeles County took that effort. I hope you all know that, we will continue to follow the trends. And if the trends dip in an area that's concerning, we would put forward recommendations to do similar things and put in restrictions if we, from a health perspective, it calls for it. Right now, our numbers are favorable in terms of the case levels as well as the percent who are vaccinated. But obviously we'll continue to monitor. And the second thing to keep in mind as well is it's summertime and people are traveling. I will use myself as an example. I'm hoping to take some vacation in the next several weeks and still thinking through where to go. Because even though being fully vaccinated, being very cautious and careful about, these potential places are having a little bit of a crisis right now. We're seeing an uptick in cases. And so what I would say to folks who are at home is, as you're planning out your vacations and you're planning out your summer travel, just be mindful of that. And, again, to make sure that even when you're in other spaces or other countries, it might not be a bad idea to continue to adhere to some of those public health guidance, whether it's wearing face coverings and minimizing your exposure to folks outside of your network. And, it still currently is a requirement to re-enter the country. You have to have a negative test as well. And so we just want folks to just be mindful of that as they make those choices, and think through coming back or getting some type of enjoyment throughout the summer.
I appreciate that. And then just lastly and quickly, the deep red areas that we've talked about many times, and Councilman Reamer mentioned this as well, and the eastern border, and then we have some going up county. One of the things I really worry about, and I live in and near these deep red areas, and I encounter people who I know are not vaccinated and are not wearing facial coverings, and have kind of gone along with the general lax of what you see in public polling of like, we've gotten over this and I can do what I want. And there may be some hesitancy there too. So I appreciated you addressing some of the myths that I continue to hear repeated, about the vaccine. I am worried that with the conversation we just had, that when you have confined deep areas of concentrated people who aren't vaccinated, that we could have these kind of mini breakout spreads if the variant takes hold in one of those communities. And I know you're concerned about that too, but so whatever we can do to ramp up, the messaging side, the mobile units, I'm happy to participate. I really am concerned about that. Actually, the farther we get along, the more of our general population that gets vaccinated, the more people get lax and don't get back. It has a reverse effect almost, I'm seeing. And I'm really, really concerned about it. So as I know all of us are. So just please keep us posted about what we can do. I agree that incentives, we need to have everything that we can do to encourage those folks. I had a conversation yesterday with two young African-American folks in the Briggs Cheney area. One of them was an expectant mother. Neither had been vaccinated, and they had no plans to be vaccinated. And I talked to them from a distance with a mask for about 10 minutes, and I think I made some progress, but it just shows that we have some issues there. And so I know you're trying, but let's do as much as we can and let us know how we can help. Thank you, Mr. President.
Thanks, Councilmember Jawando. I'll just bring up the rear here. Let me add my thanks to the chorus of gratitude for everything that you all are doing to get us to this point. Just a couple quick questions. Great to hear about the potential vaccine for children under 12 and the fall rollout. Can you talk any more about the planning for that, including whether you'll work with MCPS and their powerful communication network to get the word out to parents?
Yes. I suspect that, thank you, Councilman Rucker, Council President Hucker, for the question. I suspect it will mirror a lot of the efforts that went into getting our 12 to 18-year-olds covered. But we also remain optimistic that by the time that comes around, that there will be also better and more equitable distribution to pediatricians and primary care providers throughout the community to increase the points of entry and points of access for folks to be able to utilize. Unfortunately, this first time around, that process was not very well oiled and very well executed. And so we're hopeful that the next time around that there will be more seamless distribution to that source to be able to support, the larger county efforts and any other efforts that are out there to be able to provide access for those folks.
Thank you. And speaking of equitable distribution, I had been asking for disaggregated vaccination rates of 12 to 15 and 12 to 18 year old cohorts. I'm told there's challenges to analyzing those rates. Could you explain where we are with that project at all?
Yes, I mean, we've responded to multiple times with that, and I believe the data folks have shared those concerns. We're happy to revisit that conversation. I know they're working on being able to disaggregate the data. I can't speak for them because I don't run those numbers. I read the reports when they're completed, but happy to circle back and have another conversation to check on the progress with that.
Sure. Okay, thank you. And finally, Dr. Gales, thanks for your remarks about the effects of extreme heat and the need to take advantage of cooling opportunities. I did finally want to remind all our viewers that this council passed legislation requiring our landlords to provide working air conditioning to all of our tenants as a public health imperative during these years of rising temperatures. So please, for any of our tenants in rental housing or anyone who is in touch with our tenants, they should call 311. They can call my office as a backup if they don't have any air conditioning, or if their air conditioning is not working and their landlord's not responsive. This is a public health briefing, and I learned from Dr. Bridgers that extreme heat exacerbates heart conditions and respiratory disease and diabetes and other medical conditions, all of which disproportionately affect our Black and brown residents. We don't want any more deaths or illnesses of our residents due to extreme heat. So please call us today if you don't have working air conditioning. Thank you so much for everything that you all are doing, and we look forward to the next briefing. Appreciate it.